make it tonight.
You're all set. It started recording already.
Thank you, In Touch. And hopefully everyone can hear us okay. But if you are still having difficulties or are experiencing any difficulties, then please type in the chat box that you're having an issue. One of us will be there to help you. Tonight we're using the GoTo training platform to host this training. But before we begin getting into the meat of the training, I'm going to let Rebecca give you a quick tutorial of the control panel. Rebecca?
Yeah, good evening, everyone. Okay, so let's just get to know our control panel first. Kathy, you might still be paused.
Oh, shoot. I went
sharing.
through all these neat little slides and I was paused.
I didn't even notice, sorry.
I was mesmerizing by my voice, huh?
Yep. I did the same thing last time. Okay, so let's get to know our control panel. So here is what our PC users are going to see. The one on the left is the desktop version. Most of you are seeing that. And on the right is the web-based version. A couple of you do have that. It's a little simpler. The mute button for both versions is the microphone icon. You don't have to do that because we've already muted you. If you're on the desktop app, you can show or hide your control panel by pushing that red button, that red arrow, sorry. If you expand or collapse the panes, which is pushing the plus sign, you can expand or collapse them to show or hide their content. And on that web-based version, or both of them, if you just hover your mouse on anything, it'll tell you what everything is going to do. You'll be utilizing the chat box tonight to ask questions or to reach out to our organizers. And the content in the pane is going to automatically collapse after a few seconds, so that control panel will get out of your way. The materials icon is the one that looks like a piece of paper, or it's going to say materials. And all those materials we're going to refer to them during the training today. The most important thing is your audio connection. If you are calling in by phone tonight, make sure that you enter the PIN number that's going to show in the audio panel, or the PIN that we send to you in the chat box. So just double check. Actually, do me a favor, triple check if you're on the phone that your phone is. We've had some issues with that. If you're connecting via the app, meaning on a smart device, you'll just tap once on your screen and you can see all your control panel options. Yep, it'll look just like that. You can get to all the same things that everybody on the computer can do. And then lastly, just this is how you find your chat box under chat, or under the little chat little blurb icon. Everything has an icon these days. Let us know about your tech issues and ask your questions to the presenters. And that's it. Thanks, Kathy.
No, thank you, Rebecca. That was great. All right. So tonight's training is being facilitated as part of RCAP's National Private Well Program, which is funded by the United States Environmental Protection Agency. RCAP's objective with the Private Well Program is to protect the quality of water in drinking water wells and to help homeowners understand how to keep their wells in good working order. This will be accomplished through a diverse set of technical assistance, outreach activities, and training such as this one here tonight. And this is a recent development too, is this training was approved for 1 hour of educational credits towards New Hampshire well pump installer's license. So big shout out to Bill Arnold. I don't know if you're on that training call or on the training call right now or not, but he helped facilitate that with Abby at the DES. So thank you for that. And for that reason, in the follow-up email, which you should be receiving most likely tomorrow, we will be including a certificate of attendance for you. RCAP Solutions, just give a little bit about ourselves. RCAP Solutions is one of the 6 regional nonprofits that makes up the national network called Rural Community Assistance Partnership, or short for RCAP. RCAP has technical assistance providers in every state and territory dedicated to working with both public and private drinking water and wastewater systems. RCAP Solutions staff covers New Hampshire, and we have three technical assistance providers living in New Hampshire, and we cover the rest of the northeastern states. I'm here in Bangor, Maine, and In Touch, one of the other organizers in New Jersey, and Rebecca, you just heard talking. She's in Massachusetts. And we're also in Puerto Rico and the USVI, and that's shown there in the purple. So did I skip over something? No, I didn't. Okay. So RCAP Solutions has partnered several times over the years. We were just talking about this, weren't we, Mandy? With the New Hampshire Division of Public Health Services to deliver these private well trainings to New Hampshire residents. And now we are also excited to have New Hampshire Water Well Association join our panel of experts. And I think In Touch threw into the chat box too, that we also have several resources that you can material section of the control panel, but and you can download those into a file on your machine or your computer or device. However, we will be sending out a follow-up email. So if you're having trouble accessing those materials, they will be accessible to you in a follow-up email through just a simple link. With that, I'd like to introduce our first speaker, Dan Grace. Dan is the co-owner and vice president of sales and marketing with Capital Well Clean Water Center. Additionally, Dan has been the acting president of New Hampshire Water Well Association for the past 8 years. He's really keeping our industry strong, protected, and independent. So I appreciate Dan being on here. And Dan, whenever you're ready, just go ahead and turn on your camera and take it away.
Unmute. All right, I think we got it figured out. Hey, everybody. Thanks for joining us tonight. And I will do my best to go over what I can here in the short window of time that we have. We found anytime we do these seminars or conversations about wells and water, that there's a lot of questions. There's always a lot of questions about where your water comes from. You've got this little pipe in your front yard and water comes out of it. A lot of people don't know how, a lot of people don't know where that water comes from. So I'm here just to explain a couple different versions of what you could have to get your water from. It could be anywhere from a drilled bedrock well, like we have the diagram up here. We made this, I think, 2 years ago to try to better illustrate how a well works. And this would be a drilled well, drilled bedrock well, otherwise known as an artesian well. Technically speaking, an artesian well is a drilled well that has enough static water level that overflows out of the top of the well casing. So that's the true definition of an artesian well, but for all intents and purposes, it's fine to call it that. And it is showing that piece of casing that you stick out of your yard, that wellhead there, how the casing protrudes through the overburden. And that's where we're going to explain where these 3 different aquifers that people capture water out of, typically in the state of New Hampshire, if you're on a private well system. So the drilled artesian well, that's what we install as a company. We've got 35 years of experience. We have 3 drill rigs in the state, from northern New Hampshire and Lancaster down to the Concord area. We pretty much service all of New Hampshire, parts of Vermont, and parts of Maine. We're licensed in these states to get things done, and the closer to home the better, but we do spread out. And this here is what we do. We install the casing, the 6-inch pipe that's sticking out of the ground, into competent bedrock. And that can be anywhere from sticking out of the ground, like you'd see on the side of the highway where those cliffs blasted. That is bedrock, that is ledge, that is solid rock, all the way to the center of the earth where it turns back to liquid, where the magma resides. but we don't get nearly that deep. Your average well depths in the state of New Hampshire, anywhere from really the shallowest you see is about 100 feet, and they can go in excess of 1,500 vertical feet to try to find fractures down in the bedrock. So this casing acts to protect the well from contamination, and it also holds back this overburden. The overburden material can be anywhere from sand to till to any amount of things that rides above the ledge, and that was kind of created due to the glacier that moved over the earth, and it kind of pulled stuff from the north and dumped it in the south sides of hills. So a lot of times in the south side of a mountain, we can find a couple hundred feet of this overburden before we hit bedrock. And we've got a pretty good map of that in the state of New Hampshire. So when we provide an estimate for a well, we can look at how deep it is to ledge, get an idea of how much casing is going to be installed. That's then sealed into rock, and then from there down is just the hole in bedrock, looking for single fractures that are residing down in the bedrock. It's not an underground pond like some suspect, that there's this level aquifer that resides down there, and it's not the case. You can drill a well 100 feet and go 50 feet away, and drill the well 1,000 feet and not hit water. It's very independent of each other. But those fractures add up to give us a certain gallon per minute. Then that is under hydraulic pressure to fill that well casing. It's going to want to go up that 6-inch pipe rather than go out the backside of the fracture that it used to go down, because it's tighter, and that gives you a static water level. And all this combined gives us an idea of how deep we have to drill and how many gallons a minute we're looking for to survive a house for whatever the size may be. So this is your drilled well. This is going to stay consistently safe from bacteria contamination, overburden contamination of anything spilled up top here. For the most part, a properly constructed well will kind of be safe from that sort of thing. So jumping from there, you can go to a dug well, which would be surface water, anywhere from 6 to, I've seen 20 feet deep in the overburden, where that is dug down. If you were to take that section there by the tree and dig a hole, encase it with 3-foot well tiles by 2 foot tall, they're independent well tiles. You stack them on top of each other, backfill with crushed stone or some sort of reservoir material that'll keep holding surface water in that reservoir, so you have a larger capacity of water, because you don't have the depth that you do in a drilled well. And they work in some places. There's many of them in the state. Although I think as of last year, a lot of them were replaced, because those are the first to get impacted by drought conditions. So that water is just getting recharged by rain and the surface moisture that can get in there. But with that also can bacteria, I'd say 9 out of 10 contain coliform or E. coli bacteria that we've tested. Typically recommended to treat those with UV light protection, so that you don't get the contaminants that usually find their way into a dug well. The third aquifer would be right above ledge, or actually it doesn't matter. There's a gravel line. In some places these are applicable, in some places they are not, and it's called a gravel pack well or a driven point well, typically in a sandy area or in an area near a river where you can go extending beyond the river's banks, where there's still a coarse gravel under there. You can set a shallower well, anywhere from 40 to 80 feet we see, and that will capture a gravel aquifer that's usually pretty clean water. It's being filtered by the gravel. It's made its way all the way down through the overburden. It's spent some time underground. A lot of municipal water systems utilize these because you can pull an extreme amount of water. 300, 400 gallons per minute can come out of one of those wells. They are subject to contamination because it's not as far to travel, and it doesn't have to get through the upper layers of impermeable bedrock. That helps filter a lot of that stuff out before it gets into a drilled bedrock well. But those are the 3 main water sources that we see in the state. All have their independent issues or contaminants. Take a bedrock well drilled in New Hampshire granite, there's a likelihood in a lot of areas that it's going to contain uranium or radon coming from the ledge in the granite itself. Uranium is a big one. I believe New Hampshire is somewhere around 45% higher risk of bladder and stomach cancer than any other state in the country due to potentially the higher levels of uranium that we have in the water. And a lot of it wasn't tested for many years. So if you haven't tested for uranium, it's a wise idea to get that checked out. Now it's a standard on our water tests, now that we're more aware of it. Arsenic also resides in the bedrock wells that you can find. The radon levels are another danger. That's second leading causer of lung cancer, next to cigarettes. So it's not safe. There is certain levels that you can ride underneath, and it's not really a short risk, but none of it is good, and all of it is treatable. And on top of the drilling aspect, our company, I don't know if anyone, you look us up, we also do an extensive amount of water filtration. So we've got a really good idea of what's what in what areas in the state, and we can guide people as to what to look for and what to test for, and get that taken care of. I'm not trying to plug our company, but we do offer a lot of these things that can help everybody, and we make it really easy to get your water tested and figured out. The contaminant situation you run into in the dug wells we went over, surface water, you're going to get any runoff, any oil, more prone to bacteria, as we talked about. Low pHs, the acidity of the water is often low, which makes it aggressive. It's in the 5.5s to 6.5 sometimes. Those are hungry waters. They want to eat the copper plumbing in the house. You see green staining in your house. That's not actually the water. That's dissolving the copper plumbing in your house, and it's oxidizing in your sink, creating that stain. So if you recognize that, that means you're drinking copper in your water. And when houses before 1984 used lead solder, and some after, because it works so well, it will produce lead in your water test as well. So, you know, now the state's cracked down on that. It's not as big of an issue in recent homes or with PEX piping, but a low pH is definitely something that should be looked at and corrected. And then there's also the city water applications, which, you know, we go to certain houses that aren't even sure what they have for water. And city water is a whole nother dynamic, of course, not on the well issue, but there is their own set of contaminants that you have to watch out for. And it's a wise idea to test for different things that are in that, and also treat. If you don't like the smell of bleach in your water, it's very easy to fix for your whole house. And that one, that has been a big endeavor for us in the past few years, and people recognizing the taste and odor of the water is pretty terrible. So I guess on the topic of wells and contamination, there's a million questions I can answer, or I can go on and on about all different angles of it. Myself, my business partners, we've all been in this industry almost our whole lives. We're passionate about it, and we're happy to answer any questions anybody has, and we have resources to help anybody if they want to fix their water or ask any questions. And if we can't help you, we know people in the industry that can, if they're better suited for you or are more local. I'm not afraid to give out names of some quality contractors that are out there doing the same thing we're doing. Or I'd like to see close to the same thing we're doing. I like to think we do a little bit better, but so I suppose on that.
And that was a very good plug. That was a very good plug, Dan.
I think I'm out of time.
That was good. No, thank you very much. And we are having a few questions come in, but because of how many people are out there and the diversity of the questions, we're going to let go ahead and do the presentations, and then we're going to give the contact information of Dan and Mandy, who's up next, and Martin afterwards. So if you have, you know, and then you can direct those questions directly to them and maybe get some additional technical assistance as well, more specific to your well, because, you know, as someone that's been out in the field, I think, Dan, you could agree with this too, and I'm sure Martin could too. You know, each one's different. Each one's a specific case. So with that, let me
I'll turn my camera off.
All right. Thank you very much, Dan.
No problem.
And up next, we have Amanda Kosser. Amanda is the administrator and lead epidemiologist for the biomonitoring New Hampshire. I'm going to mess it up, Amanda. Just messing it up. Biomonitoring at the New Hampshire program. Did I say that? Biomonitoring New Hampshire program at the New Hampshire Public Health Laboratories. It's always a mouthful with you, Mandy. Mandy's been there for 14.5 years, and since 2015, Mandy has been working on the biomonitoring projects, evaluating human exposure to environmental chemicals like arsenic, uranium, and lead. Her program is funded through a grant from the CDC, National Center of Environmental Health. And with that, Mandy, we'll pass the presenter role over to you.
Great, thank you so much. Just waiting for that to pop up.
Did you get it?
I believe
There you go.
I did.
You did, yep.
Okay, thank you. All right, hello. So tonight I'm going to tell you all a little about my program, the studies that we've done, and the potential impact of your water quality on your health. So first, what is biomonitoring? Well, it's a method for looking at exposure to chemicals from the environment in people by testing their urine, blood, hair, nails, or tissue. So we test these specimens listed here to look for either the chemical or its breakdown product, or also called the metabolites of it, which tells us whether you were exposed to the chemical. So what's in your environment? Well, there are many ways we come into contact with chemicals. The air we breathe, the foods we eat, the water and beverages that we drink, and the products we use all contribute to the amount of chemicals in our bodies. We also need to think about the chemicals we're exposed to at work, with our hobbies, and with our recreational activities. Some of these chemicals are helpful to us, like bug spray to prevent mosquito bites, which is safe on our skin, but we need to wash our hands before eating or cooking so we don't accidentally ingest it. And of particular importance to private well users are the chemicals we may ingest when drinking or cooking with our well water. And I'll go into detail on those in just a few slides. So biomonitoring can tell us whether people are more at risk for having high levels of a chemical in their bodies, so we can take action to reduce their exposure. And just a made-up example of this is finding that a certain group of people all have very high mercury levels in their blood. And their answers to a survey from a biomonitoring study have indicated that they all ate a lot of fish caught in the same river. And the scientists in this area know that there is environmental mercury contamination from an old factory, and they suspect that the mercury from that factory site has gotten into the river. So in order to prevent further mercury exposure, warning signs advising not to eat the fish caught in that river are placed in the area. So to summarize, biomonitoring is done to learn how we're exposed to chemicals and how much is in our bodies so we can reduce our exposure and live healthy lives. So our lab, the Biomonitoring New Hampshire program, is at the New Hampshire Public Health Laboratories in Concord. Our lab has completed 2 biomonitoring studies evaluating chemicals in people and exposures from their environment. The Targeted Arsenic and Uranium Public Health Study and the 2019 Tracking and Assessment of Chemical Exposures, or TRACE study, which was a statewide surveillance study. And with funding from the CDC, the New Hampshire Environmental Public Health Tracking Program, and the New Hampshire Department of Environmental Services, which I'll refer to as DES, as well as assistance from the New Hampshire Public Health Lab's Water Analysis Laboratory, we were able to test both people and household water samples in both of these studies. So now I'm going to talk about the intersection of water quality, biomonitoring, and health. I will also review the potential health effects of some of the most common well contaminants in New Hampshire. It's important to note, though, that some health effects have been associated with exposure to certain chemicals, but this doesn't mean that those chemicals are definitely causing the health effect. It's very difficult to tease that out because people are exposed to many different chemicals in their daily lives. But first, why should you test your well water? 46% of New Hampshire residents rely on private wells for their household water source. There are no state regulations requiring that water be tested or treated if indicated. No state regs requiring that your private well water should be. Public water systems are required to test and treat, but this is very different for private wells. There are many naturally occurring and man-made contaminants that might be in your wells, many with no smell, taste, or color, but they do have the potential to impact your health. Whether you get sick, though, depends on many factors: how much, how often, and for how long you're exposed to the chemical, the route of the exposure, whether you're ingesting, breathing, or it has contact with your skin, and personal factors like your genetics and just your overall health. Only public water systems must regularly test the water they distribute and treat it if treatment is indicated because a contaminant exceeds a health advisory level, also known as a maximum contaminant level, or MCL. That's how I'll refer to it in this presentation. Additionally, not all contaminants have health advisory levels. These levels are established by considering both the potential health effects as well as the financial cost to remove them from public water systems. For this reason, some contaminants may have a maximum contaminant level, like in New Hampshire, where we have a new MCL of 5 parts per billion for arsenic, and that's effective July 1st. However, because of its potential to impact health, the health goal is actually 0. You don't want any arsenic in your household water because it's unknown whether how long-term low exposure could affect your health. It's important to strive towards your home water being as close to the health goal as possible. Some common contaminants in private wells in New Hampshire are arsenic, uranium, radon, iron, manganese, and bacteria. Lead and copper are also common, but not because of the groundwater. Lead and copper actually come from the home's plumbing or fixtures like the faucets. Well water that is corrosive, like Dan just talked about, so a low pH, meaning it's like more acidic, plus a few other factors that affect how corrosive your water is, help these metals, the lead and copper, leave the plumbing and enter your water. New Hampshire has a high potential for natural arsenic contamination of the groundwater aquifer due to normal wearing of rocks and minerals. There is also potential for man-made contamination due to New Hampshire's farming history and previous usage of pesticides that contained arsenic. We conducted a biomonitoring study evaluating arsenic and uranium in people who had private wells, and this highlighted this boxed area of New Hampshire because they were at increased risk for high levels of arsenic in their groundwater based off of this modeling done by the U.S. Geological Survey. Arsenic was an important metal of interest for the biomonitoring study because it's estimated that 30% of wells in New Hampshire exceed the MCL, the maximum contaminant level for arsenic. New Hampshire has the highest bladder cancer rate in the United States, and one of the leading causes of bladder cancer is arsenic in private well water. Tobacco smoke, like Dan mentioned, being the other. The 2 new biomonitoring New Hampshire studies I just mentioned have shown that arsenic from home water seems to be contributing to a higher level of arsenic in the urine of people drinking that water. Both studies have found higher levels of arsenic in the urine of people who drink 4 or more cups of their home water per day when that home water has high levels of arsenic, so arsenic above the maximum contaminant level. And then besides bladder cancer, arsenic has been associated with increased blood pressure, gestational diabetes or diabetes during pregnancy, hormone changes, and a reduced immune response to respiratory diseases. Uranium was another metal of interest in our biomonitoring studies because it's estimated that 15% of bedrock wells in the Northeast exceed the maximum contaminant level for uranium. It's also naturally occurring with no taste, color, or smell. It can cause kidney damage and can affect the integrity or the strength of your bones. It can also cause respiratory diseases if you're exposed in other ways, like mining. Biomonitoring New Hampshire studies evaluated whether the amount of uranium in a person's urine varied depending on how much of their private well water they drank. Our program found, again, that there was more uranium in urine when people drank private well water that contained high levels of uranium. We also found that the concentration of uranium was highest in urine when the water concentration was above the MCL. So again, we found it in urine if people were drinking contaminated water. Radon gas is released when certain metals like uranium decay. Radon exposure is the second leading cause of lung cancer in New Hampshire, with tobacco smoke being number 1. However, it's the leading environmental cause of lung cancer. It's estimated that 100 New Hampshire residents die each year due to long-term exposure to radon. Of most concern is breathing radon gas. The gas can enter your home air through cracks in your foundation or by exiting your water when showering or washing the dishes or running your dishwasher. 88% of the health risk from the radon in your water, though, is because it's exited your water and entered just your ambient air in your home, and then you breathe it in. In the US, 7% of homes have elevated air radon, but in New Hampshire, 30% of homes do. If you haven't already done so, you should also test the air in your home for radon gas on each level below the 3rd floor, so your basement, your 1st floor, your 2nd floor. Use an accredited lab for testing and an accredited radon mitigation company if indicated. The Biomonitoring New Hampshire Trace Study, so our statewide surveillance study that we did in 2019, found that 37.5% of private well households exceeded the water screening level for radon versus only 4.3% of the public water system households. So there was a much larger risk of high radon levels in private well water. Like I mentioned earlier, the concern for lead and copper is not from naturally contaminated water, but rather from your home's plumbing or fixtures if your well water is corrosive. Corrosive water has a low pH, so less than 7, it's more acidic, as well as some other physical and chemical characteristics that allow these metals to leach or exit your plumbing and enter your water supply. Lead can affect the brain and can lower IQ, cause behavioral problems, seizures, brain damage, and delayed development. There's no safe blood lead level. Higher doses of copper may cause nausea, vomiting, or diarrhea. The Biomonitoring New Hampshire Trace Study found a trend towards a higher concentration of blood lead when private well water contained higher levels of lead. Iron and manganese are also naturally occurring. They're called aesthetic contaminants because they can cause staining or affect the taste of your water. The current health limit for manganese is 0.84 milligrams per liter with an aesthetic limit of 0.05 milligrams per liter to protect against staining. It is important to keep in mind that there is a screening level set for manganese, and that's 0.3 milligrams per liter due to the potential negative effects it can have on the infant brain, so neurological, neuromotor, and cognitive effects. New Hampshire Department of Environmental Services is working on a new enforceable drinking water standard, so a new basically maximum contaminant level for manganese to be effective on July 1st of 2022. And by making this standard and setting it at 0.3, they're going to make it protective for infant health. And then public water systems would need to abide by this and make sure their water is below this standard. And so it is our recommendation that your private well water is also below 0.3 milligrams per liter for manganese. Dug wells and springs are more susceptible to bacterial contamination, as well as those with unsealed caps or corroded or leaking well casings. So bacteria from surface water is filtered out as the water is absorbed into the ground, and so properly constructed deep wells are less susceptible to contamination. Total coliform is present in soil, and indication in your well water may mean that more harmful bacteria are present. This doesn't automatically imply a health risk, but you do need to determine how bacteria is entering your water supply. If there's evidence of total coliform bacteria in your water, then other types of more harmful bacteria, more pathogenic bacteria, may be able to get in. E. coli is a fecal coliform. It is normally found in the intestines of mammals, and it poses an immediate health risk, and so the contamination must be quickly addressed. Babies, young children, and the elderly are especially at risk for the health effects from fecal coliform. You should test your well water annually, so every year, for bacteria. And that's going to bring me to some testing recommendations from New Hampshire DES and the New Hampshire Public Health Lab's Water Analysis Laboratory and the tests that we offer at the state lab. So we recommend testing every 3 to 5 years for metals and radon, which you can do by ordering our Standard Plus Radon package, and it's listed here. You'll have access to these slides later on, which you can download and easily then click on any of the links that I show here. So radon and radiological testing is not recommended for dug wells or wells that don't reach into the bedrock. We recommend yearly testing for bacteria, nitrate, and nitrite with our basic analysis, so that's $30. And our lab also offers a new home buyer package if you were to be shopping for a new home that's on a private well, which would be the standard analysis without the stagnant lead and copper testing, so it's at a slightly reduced price. So you can order a test kit for our lab at the link here, or just search for New Hampshire DES homeowner container request. You could give us a call at the number right there. And we will mail one of these test kits out to you, and you don't pay at that time. You pay when you return the samples to our laboratory. But of course, you don't have to use the state public health lab water analysis laboratory. You can use whatever laboratory you want. We just want to make sure you know to use an accredited lab. So just use the lab that's certified to perform this testing, so you know they're using just high standard products, high standard methods. So our recommendations for you are just test your water. Test it every year for bacteria and nitrates. That costs about $30 to our lab. Test it every 3 to 5 years for that standard analysis with radon. So that can be about $85 to $105, depending if you want to include the radon. Test your water each time you have work done on your well. If your well flooded, if you notice a change in the taste, color, or smell, you need to test your well to make sure that your treatment system is working. You can't just rely on it to always work. Those systems need to be maintained. And so test your well to make sure it's working. Test your well to make sure that you don't need to do any additional maintenance on it. And of course, test before you buy a home with a private well. Discuss your water results with your healthcare provider. You know, like I mentioned today, some of these results could affect your health. To learn about your results and water treatment options, New Hampshire Environmental Services has a really great tool called Be Well Informed. I think Martin's going to speak on that a little bit more, but I have a link here to that tool. Basically, you'd enter your results and they'll walk you through how to interpret those results and treatment options if needed. And then, of course, install a treatment system if needed, maintain that system. There are many different systems out there, varying prices from whole house to just a point of use at your kitchen sink, or sometimes you could just get a water filter pitcher that you can store on your counter or in your fridge, and that would help you. Again, you're going to get all these resources with all of these links mailed out afterward, or you can get it from the materials area right now. So just some great resources for you guys to check out later. And so I just want to acknowledge, you know, our partners at the Public Health Laboratories. The Water Analysis Lab does so much work for us, so we're able to give our biomonitoring participants paired results. So not just their clinical specimens, their urine and their blood results, but also their home water results. So we can really take a look at how their water quality could be affecting their health. We work closely with the New Hampshire Environmental Public Health Tracking Program for analyzing our data, for funding for some of this water testing. Same with the Department of Environmental Services for helping us with our reporting, for water sampling and funding for water testing. And the Dartmouth Toxic Metals Superfund Research Program are really close partners on education about the impact of environmental contaminants like these that could be in your wells and health. And so there's my contact info, and I'd be happy to take any questions by email or later on if we can chat. Thank you.
Thank you so much, Mandy. That was wonderful. And, you know, I have to say, too, that, you know, I've worked in a lot of states, but the collaborative efforts and the ability to give technical assistance is outstanding in the state of New Hampshire. So any of those partners that you listed, I've always had very good luck with accessing their skills and knowledge. So thank you for that recognition. All right. With that, we have Martin Mistretta up next. Martin Mistretta is RCAP Solutions Private Well Coordinator for New Hampshire and has been leading our efforts for providing on-site private well technical assistance for the past 2 years. And so Martin is going to lead us through some of our private well program highlights and give us some resources that are available to you as a New Hampshire resident. So with that, Martin, if you're ready.
I'm ready.
All right, I'll hand it over to you.
Great, thank you, Kathy. So as Kathy mentioned, I'm going to talk about some of the resources that are available to private well owners and well users. The first resource I'll talk about is the private well class. This is a free online course that anyone can sign up for. The course educates private well owners on topics such as groundwater, well construction, well water systems, operation and maintenance, water sampling and testing, and water treatment solutions, to name a few. They cover other topics as well. This website also has several webinars that you can sign up for, or you can view past webinars on various well-related topics. To sign up for the online course, it's very simple. You click on this tab at the top. It says Enroll in Class. And when you do, it will bring you to this page here. Participants are asked to sign up by providing an email address, first name, and the state you live in. Once you're signed up, you'll receive 1 lesson per week over a 10-week period. Each lesson is about 6 to 10 pages of reading, so it's not too much, but it's enough to give you good information. And this is an excellent website if you're interested in learning more about wells or drinking water. Another resource for well owners is the RCAP Private Well Program, which is grant funded by the US EPA. RCAP's Private Well Program is a national program expanding across all 6 RCAP regions. And our goal is to provide education and outreach to both private well owners and stakeholders. To do this effectively, RCAP National has partnered with the Private Well class, which was developed and is managed by the University of Illinois. RCAP also partnered with the National Environmental Health Association, the National Groundwater Association, the Water System Council, along with some other well education programs. In addition to offering educational webinars, such as the one this evening, the RCAP Private Well Program also offers free well assessments for private well owners. A well assessment is basically a sanitary survey which can help identify potential threats or contaminants to your drinking water. Well assessments include a visual inspection of the well and surrounding area, also a personal interview by means of completing a questionnaire, and then an evaluation with recommendations. RCAP also provides free educational material, and in New Hampshire, I always provide a water sampling bottle kit to the well owner whenever I conduct a well assessment. So prior to a site visit for a well assessment, I usually do a little research to try and gather any available information on the well if the well owner does not already have it. Then after the site visit and all the available information has been collected, I'll email the report with recommendations to the well owner. On the national level, RCAP also shares the well assessments with the University of Illinois. Personal information of the well owner is kept confidential, but the data from the report may be extracted to determine national trends to help better serve private well owners. And the well assessment questionnaire includes sections with questions related to various topics that you see here on this slide. For anyone interested in a free well assessment, you can contact me directly and I can schedule it for you. Or if you happen to be a town health officer or other type of stakeholder and you're interested in learning how to conduct well assessments in your community, just contact me and I'd be happy to help you out with that. So I thought I would share just a few photos of some of the things we've seen in the past doing these well assessments. This one here, this is a dug well. In this particular well, you can see there's exposed electrical wires and open conduit, both of which are potential problems that you'd want to have corrected. This next photo is a drilled well where the conduit had pulled away from the cover, exposing the electrical wires. It also has an old cover that does not provide a sanitary seal. And on the photo on the right with the cap off, it shows where mice decided to make a home inside the well casing. Obviously, these are problems you'd want to have corrected. And this last photo, this is another dug well. You can see from the photos of the interior, there's vegetation roots that are protruding into the well through the joints in the well tiles. In the photo on the right, there's actually a little frog sitting there in the well tile joint. So again, these are the types of problems you'd want to have corrected. And so the next resource I'll talk about for well owners is the New Hampshire Department of Environmental Services Be Well Informed Guide. This is an excellent resource for when you get your water tested. This is an online tool created by DES, which is designed to help people understand the laboratory analytical results of their water tests. The Be Well Informed Guide provides an interpretation of the lab results using the water quality standards. It also provides guidance on water treatment options for various contaminants. And it also provides information regarding health concerns pertaining to certain contaminants. To use this online tool, it's very easy. This is a screenshot of their webpage. You click on that green button at the bottom of the page, which is labeled Enter Your Well Water Test Results. And when you do that, it brings you to this page. So after you've sampled your water and you get your test results back from the lab, you simply enter your lab data for each test result on this page and then just hit the Submit button at the bottom of the page. Once you've submitted your lab test results, the Be Well Informed Guide then generates a report that users can save, print out, and discuss with a treatment vendor. The report is composed of 3 parts. Part 1, which you see here, is the results summary. So this provides an overview of the values entered and compares it to the current standard or MCL, and it lets you know whether or not the test results meet the drinking water guidelines. Part 2 of the report is referred to as the treatment train. This shows the user 1 or more treatment technologies in proper sequence to address the contaminants of concern based on the lab results of your water sample. Part 3 of the report is the results detail section, and this contains narrative that interprets the water test results, providing an overview of known public health concerns when appropriate, and corrective treatment options. There's also links to other sites for additional information. Another resource for well owners is the arsenicinU.org website, which was developed by the Dartmouth Toxic Metals Superfund Research Program. This is an educational website about the potential risks of arsenic in food, water, and other sources, and how you can respond. This next resource for well owners is the U.S. Department of Agriculture Rural Development. The USDA offers low-interest loans and grants to low-income homeowners to make repairs to their homes related to health, safety, and efficiency. This also includes things like wells and septic systems. And this is known as the 504 program. This slide shows some of the eligibility requirements for the USDA 504 program. The program is really intended for low-income rural homeowners, and for the grants, they're only available to applicants age 62 or over. And here, this slide, I just put up the contacts for the USDA 50 program in New Hampshire. I've also included their website address at the bottom of the slide. But these slides are all in the materials that are available to you to download. And another resource for private well owners is the New Hampshire Drinking Water and Groundwater Trust Fund Drought Assistance Program. The Trust Fund Commission approved funding of $1.5 million to this program back in October 2020. The effective date of assistance is retroactive through June 23rd of 2020. And this program is for low-income homeowners who are experiencing drought-related loss of safe, reliable drinking water at their primary residence. For well mitigation assistance, applications need to be submitted to DES by both the homeowner and a licensed New Hampshire water well contractor or pump installer. And I've provided an email address at the bottom of the slide if you're looking for general assistance there. And the last resource that I wanted to go over is the New Hampshire Department of Environmental Services website, which this is their homepage. They actually redesigned this a couple months ago, I believe. But this is a great resource for well owners and well users, of course. Although private wells are not regulated, the Drinking Water and Groundwater Bureau at DES provide a lot of helpful information and guidance to well owners and well users on this website. So I'll navigate through this site a little bit to show you how to find some information related to wells and water quality for private well owners. You can see the website address up here, des.nh.gov. So this first tab here says water. If you click on that, you can start with that. Scroll down a little, then go to drinking water. And on the drinking water page to the right is a tab for private wells. Click on that. So this brings you to the private wells page. To find information, let's say you want to look for information on water testing. You can start with this tab here, find a lab. There's a PDF. If you click on that, it pulls up this PDF, and it gives you a list of the recommended tests for well water. This is collectively known as the standard analysis that Mandy was talking about. They recommend to do this every 3 to 5 years. For bacteria and nitrate, they recommend you do it annually. And the next page on this PDF gives you a list of accredited labs that can test your water, and gives you all the contact information there as well. Back to the private well page. So this tab here in the middle, what do the results mean? So if you click on that, there we go, and then click on Be Well Informed, that will bring you to the Be Well Informed guide. So this is the online tool that I mentioned earlier, where you can enter your test results by clicking on this button here, your lab test results. You just enter them in here, and then at the bottom, hit submit, and it will generate the report that will give you all the information and guidance that you need based on your water test results. And let's see. Okay, back to the private well page. If you scroll down to the right-hand corner here, find out more about contaminants and well water. If you click on that, it will bring you to a list of environmental fact sheets. These are all the fact sheets that are related to common problems with water quality in wells. So you can see there's a variety here. You know, for example, here's one for arsenic. Click on that. And these fact sheets are really helpful. They provide a lot of good information and guidance. You know, they talk about health effects, health standards, testing, and treatment. So you can get a lot of information out of these fact sheets. Now, you know, this list here, there's a couple pages worth. These are just some of the common fact sheets for wells, but if you don't find a fact sheet on the topic you're looking for, you can just search for it, because DES has dozens and dozens of these fact sheets. So for example, if you go up to the search window here, if I'm interested in disinfecting my well, for example, I'll just type in well disinfection, filter the results, and it brings up a fact sheet on how to disinfect a water well. So you can usually find what you're looking for. You know, chances are you can find a fact sheet on whatever topic you're looking for as it relates to your well or water quality. And I'm just going to go back to the drinking water page to point out one more thing. If you scroll down to the bottom of this page, there's a tab down here that says read more about PFAS in New Hampshire. If you click on that, it brings you to the New Hampshire PFAS investigation page. Up here in the top left, this drop-down menu, you see a choice here, getting your water tested, and then to the right, private well testing request form. If you click on that, it brings up this form that you can fill out with your information if you're interested in having your well tested for PFOA. But as they explain in this paragraph here, DES is sampling private wells in southern New Hampshire in several defined areas. So if you happen to be located in the area where they're sampling, then they will notify you. But if you're not selected for sampling, they'll just hang on to your information, and in the event their investigation expands to an area that includes your address. So you know, it doesn't hurt to, if you're worried about PFAS, or if you're in an area that you know, there've been issues. This is a form you could fill out and possibly get your well sample for it. And with that, that's about all I had, and I think we're close to being out of time. So I'm going to turn it back over to Kathy, who will be putting up our contact information.
Martin, I gotta tell you, I was very impressed on how you navigated that website. So, awesome job.
Well, the DES says they made it very user friendly, so it is an improvement, I think, over the last website. So it's easy to navigate. Yeah.
All right. Well, I'm gonna make myself the presenter again, and I'm going to give those. And I'm going to give those contact information out. Give me 1 second. And before we go, I absolutely want to thank Amanda Kosser again and Dan Grace for graciously giving their time and expertise to help us put on this presentation tonight. And they have both said that if you have any questions, that you should feel free to reach out and give them a call or shoot them an email and ask them your specific questions. I know we got a lot of different requests for information, but I think between the 3 of our presenters tonight, I think we could address just about each one of them. So I'll just hang out here for the next 5 minutes and check on the chat box. But other than that, you guys are free to go. Again, thanks to Bill Arnold for his efforts to get the well pump installers accredited, disaccredited for the well pump installers, TCHs. So that is one TCH, and we will be sending out in the follow-up email not only all the materials that were listed in the control panel, but we'll also be sending out a certificate of attendance so that you can present to Abby Fabiano at the DES if you are a well pump installer. So thank you, Martin. Thank you, Mandy, and thank you, Dan, and thank you everybody who joined us tonight. And a big shout out to In Touch and Rebecca for helping out with organizing as well.
I'm always happy to help, Kathy. You know that.
Well, I appreciate it.